Well, good morning, and thank y'all for joining us on this webinar. I've been looking forward to our time together. Our series is one that was begun last summer by the Office of Mission, and it's called Branching Out. And the idea behind it was to dive into the subject of mission interest and various ways to uh, connect with folks. And today we wanted to look at the situation around COVID and the vaccine. And it is something critically important for us to discuss now. And that's what we're going to offer in this edition of Branching Out. So I'm Jimmy Nunn, the Bishop of the Oklahoma Conference of the United Methodist Church, and it's my privilege to be with you today. We have Fletcher Owens and Ron Kelly with us today. Dr. Owens he was born in Panama. He's the oldest of five children. He was the top student at both his Jesuit high school and National Medical School. I could put the dates on those, but I will just say I can remember when those things happened. And you look younger than I am, and you're not that much younger. So welcome.
I'm up there.
Yeah, me too. He studied at the OU Health Science Center and the Mayo Clinic, and today he directs the geriatric care at Epworth Villa, and he's been the medical director there since 2001. And so thank you for being here with us today. Ron Kelly is also with us today. He is formerly of Frisco, Texas, and joined Epworth Villa as our new president and CEO in October of 2017. Prior to joining Epworth, Ron was the executive director of the Presbyterian Village North in Dallas, had over 500 residents. He's also worked with the United Methodist affiliate Wesley Manor in Frankfort, Indiana. And he also has been the CEO of that organization. And while he was there, oversaw a $12 million expansion and renovation project. And so, Ron, thank you for being here with us today. I know you have a passion for what you're doing, and it's just great to have you.
Well, thank you very much.
You bet. I want to just jump right in and just ask for both of you to respond. Tell us about the work you do and how the COVID-19 has affected that work. And Ron, why don't I start with you?
Well, certainly, this has been a challenging time to be serving older adults. Epworth Villa is a life plan community. And so, we had challenges right out of the gate. Obviously, when this first broke, we really reacted very quickly and started doing some things very differently, and life changed. We know that even the state of Oklahoma was in really lockdown. The safer at home provisions that the governor put out, all of our residents really stayed put. And so we had to take a lot of services to them. We shut down dining rooms. We stopped doing certain activities. We stopped having chapel services. We had to really learn how to do things virtually and use technology a lot differently and use tools like this. We do a daily video now that we send out every day, and we do all of our chapel services virtually. We have an internal TV system that we're allowed to use for communication and programming. So those are things probably that will stick around. Those have stretched some muscles that we weren't using to the full capacity before. But now we've really seen the benefit of it. And so I think we'll continue doing a lot of that. But the ultimate goal is to get everybody back together again. And we're in the process of actually today, we have a vaccination clinic here for the services area. So things like that are going to help us to be able to open up our dining venues again, get back into the chapel, get people together. And that is really a huge part of what we do is community. It is almost all of what we do, really, building community. And so it's been a challenge during this COVID pandemic.
Yeah, I'm sure that is true. And Fletcher, how about you? Tell us a little bit about your work and and how this COVID has affected that work.
All right. I'm again Tomas Owens, and I've been affiliated with Epworth for a long time, as you heard. My primary job is actually at Integris Health as a director of the residency program in family medicine. So just like with the rest of you, that's a dramatic change. We hold daily in-person talks about medical subjects that had to go in a virtual form uh, by virtue of having few people at the meeting rooms and others scattered throughout the office using their laptop to join. And that's from day one, which, as you guys might recall, was the infamous March 11th suspension of the NBA Thunder game. We actually made history that day by being the day that everything changed, although the epidemic had been with us. Additionally, our inpatient service volume has changed dramatically. Not only do we have more patients, but now, rather than having one or two affected by a viral illness, we have better than half of our patients admitted to the hospital to our service be patients afflicted with COVID. The rest is very similar to the rest of you. You don't go to restaurants, you don't go to the movies. All of the safety measures we have to take to work in the community, to just survive, to get to the store, things of that nature. We're still very, very blessed in the sense that with the kind of job that we have, we still have a job, and we can do a lot of our things virtually. For very many thousands of Americans, their jobs just evaporated. You're in the service industry, in the hotel industry, in the airline industry. It's been really, really difficult. And all of those things that have to be done in person have been a big challenge. As far as our hospital, for a long while, we were the primary COVID hospital in the metro. Now everybody else is caught up, but we're running anywhere between 35 and 40%. All of the patients in the hospital are COVID patients. That's unprecedented to have one disease take that percentage of people. And essentially, it's going to continue to mark the way we do things probably for many years, although it's going to be much better control, and we can discuss that a little later if you want to. But certainly changed our lives dramatically. And the personal note, this happened to be the year my son graduated from medical school. Well, there was no.
Oh, wow.
And he also chose to get married this year, 2020, and we ended up having a 10-person affair at St. John's. But that's life, adapting and growing. Thanks for.
Well, thank you. And Thomas, I misheard at the beginning on your name, so I apologize.
That's all right.
To you. That's one of the downsides of this crazy Zoom era, isn't it? That we don't get to meet in person, we don't get to talk, and we've not had the privilege of meeting one another. But just thank you both so very much for your work. It's just really outstanding.
Bishop, may I be able to add something? I just wanted to talk about Dr. Owens. Yeah. He has been instrumental in helping us here. First of all, just his care of residents and care of patients in the community, being on the front lines. I just applaud him and others that have really taken a lot of risk on themselves to be out there. And that is something that's true about the caregivers that we have here as well. They've just been, heroic, really, is the word that comes to mind. So I just wanted to express that appreciation. And in addition, education has been a big part, kind of similar to what we're doing today. Dr. Owens has been a part of a little series that we've done where we've done some Zoom calls, we've done some videos and presented that to our staff, our residents, even like prospective residents. And, you're going to get a taste of that today, as well as to how great of a communicator he is and advocate that he is for things like vaccinations.
Well, since we're in the Mutual Admiration Society, let me.
You just come right on.
I tell you, we've managed at Epworth entirely, not by me, but by the work of everyone, of course, led by Mr. Kelly, to really cut down the number of transmissions to a very, very, very several facilities have had horrible outbreaks. Get the disease in is very, very difficult to control. control it because it's so contagious. We may talk a little bit more about that in a minute. But you are not going to be a popular person. So it's been really hard on all the administrators at Epworth Villa, and I'm sure at other places, to restrict visits, to inconvenience people coming in, to have everybody wear things like this. It's been tough, but it's worked. I think Epworth an example on how to exactly do it right and maintain very, very low transmissibility and very low morbidity.
Yeah, that really is great. I've just been so thrilled with the results that y'all have gotten and the care. I know when I went and spoke at the chapel one time, it was, it was a virtual chapel. They met me at the door, had me sign in, took my temperature, and then made sure my mask was on and let me pass. And so that was certainly a good protocol. and so y'all had done a really great job with that. I want to ask you how your faith has impacted you. Where have you seen God at work in just really a heartbreaking situation, both inside and beyond Epworth Villa?
Well, early on, there was an opportunity that I took advantage of, again, with videos and whatnot. I created a video that was coping with crisis. And it was a time when I was recognizing just the burden that people were carrying, and it that cloud. I mean, it's hard to even remember. I mean, it's been almost a year ago now, but you just sort of let your thoughts go back. And we want to forget what that March and April time period was like, but there was a lot of fear and uncertainty. I mean, just did not know what we know today, and even what we know today, it still is a lot of fear and anxiety that is tough for people to overcome. And so the only way that I really know how to do that is through faith. There is really an importance of recognizing who's in control, and so just emphasizing the sovereignty of God is something that I felt important for my own faith, and I think others did as well. And I think there are a lot of questions that come up too during times like this. It's like, why is God allowing this? What is this about? And I don't have the answers to that, but I do know the reason I do know what is not the reason. It is not because God doesn't love us. His love demonstrated to us through the person of Jesus Christ is what I hold on to say he loves us. Whatever is happening, it isn't because of a lack of love. And so that's kind of where my understanding stops. And maybe someday, eternally we'll get a glimpse of that more so. But for right now, that's enough. And that's about all I can say is that faith is enough. It is something that every person has to sort of make that decision on their own, but we certainly have encouraged that here to be a big part of coping with this pandemic.
Yeah, that's great. Dr. Owens?
I can hardly add to that. Say that it's always an existential issue, right?
Yeah.
Good God, since a hurricane or a pandemic, I go more in the lines of with Mr. Kelly, lines of Teilhard. I'm a Catholic boy, so I have to theologian from their school. I think probably the Almighty leaves these natural things to their own. He has the power to stop them, and he gives us the light and the fire within us to front them and be stronger from him. And that I have definitely seen. I think these kinds of situations and at Epworth and elsewhere bring the worst of some people and the best of some people.
Yeah.
The kindness, the generosity, the philanthropy, the desire to help others every day. And there is a silver lining, and even in silly things. Sure, we didn't have the big party for the wedding, but Emily had to move in with us because it's easier to work from home at our place than elsewhere. So, there's all sorts of things to be thankful for. And of course, we're all still standing after all this. I think it's brought us closer in many ways. And I think that when I get eventually to shake your hand, Bishop, it'll be more meaningful.
Yes,
Yes.
amen to that. Yeah, yeah. I appreciate that that good word. I struggle with why question. There's no answer to why. And so I've quit asking the question why about things and began asking, God, come and show me that you are here in the midst, and that you're my helper. And so, in the words of that psalm, I lift up my eyes to the hills, and where does my help come from? It comes from the Lord, the creator of heaven and earth. And I find that a better question than why, because we can't answer that, but we can affirm our faith. And certainly the two of you have done that in a really good way. So that's just great. I just wonder if we've got Sandy Settle who's joined us. Sandy, can you hear me? And are you on the call?
Got to unmute yourself if you're muted. Sam.
Yeah. We'll just give it a second. We may run on to the next question, and we may have it's just the same way on these technical things and all of this. It's like, oh, whatever is, and we'll deal with it. So I do have the vaccines are out now. There are multiple companies that are making them. And Dr. Owens, would you just share with us your thoughts on the safety of the vaccines, and does it matter which, who the manufacturer is, and just those things from your perspective?
I'll try to be brief. I teach and they pay me to learn, so I spend hours getting updated. So bear with me. These vaccines have been developed really quickly, but on the same breath, they've been studied more extensively than many others before. With the whatever we can talk about the last 4 years, let me assure you that Operation Warp Speed was a positive. Resources that were involved, the numbers of people. One of the vaccines was tested on 45,000 people, the other one on 50,000 people. The development goes back to about 10 years ago and was kind of on hold, and this surge of finance and support let him get to the forefront this quickly. A couple of quick things that people raised the question about: what is this mRNA thing? mRNA sounds like DNA. Is that thing going to change my code and my eyes going to turn blue suddenly? mRNA and DNA are very different things. mRNA is the thing that the nucleus of the cell spits out to make protein. And the reason they went that direction is because it's way faster and more efficient for the body to create antibodies. The long and the short of it is the vaccine is terrifically safe, but yes, it has some side effects. So to go over those kind of briefly, the more important thing to remember was the severe side effects. To give a comparison, influenza vaccine has about 1 severe side effect per million people immunized. The shots that we're now using are more like 10 serious side effects for 1 million people immunized, which is 10 times higher. Yet no one has died from it, and no one so far has had any ongoing consequences. This 10 per million people just get an allergic reaction that's somewhat severe and needs some treatment, but they all have resolved. What you need to do in life then is do the risk-benefit ratio, right? Get influenza, you have about a 1 in 800 to 10,000 chance of dying from it. It's really unusual to die. But if you get this disease, you have a 0.6% chance of dying. So being a disease that's so much more severe, it makes sense to take a little higher risk. But again, 10 in a million is not an enormous number. The side effects more commonly are simply soreness in the arm, which you get with any other immunization, just the same. And then many immunizations, particularly the viral types, can give you a reaction as the immunity is working. So you get shaking, chills, sometimes fever, muscle aches. Typically, they occur within 8 to 12 hours of immunization and last anywhere from 12 to 24 hours, in rare instances longer. So I sit there and think, gosh, I had both shots, as you probably know. Uh, I feel like I've died already, I told myself. And then I said, well, dying for a day is better than dying forever. So I'm okay with that. Plus, a day is still shorter time than the Almighty was dead. So by 66%. So I think it's a small, really, in the big picture, inconvenience for the advantage of getting the shot. There's other considerations, and I'm not sure as critical in this setting, but I'm a Catholic guy, as I told you. So some of these things have been manufactured using an ancient, well, not ancient, 1972 abortion tissue, but none of the ones available right now have been. So at least the Catholic Church has deemed them to be problematic in the sense that they've used them, those lines for testing, but they're not part of the immunization, not part of the manufacturing. So they're approved to be taken by good Catholics and all that. Some of the others, AstraZeneca and the Johnson & Johnson, are not out yet, did use those old lines, and that's a different discussion. But still, the general principle, at least in my congregation, my faith, is that you do not suffer sin by proxy on this one. If you're doing this to prevent yourself from dying or loved ones from dying, other people from suffering, it's acceptable to take it.
Thank you for that that analysis and for sharing those things. And it is a matter of faith for some folks. And I am very happy that you shared the clarifying points that you did around the position of the Catholic Church on this as well. So, Rob, what's been your experience? And do you have people at Epworth Villa that ask, is the vaccine safe? Should I take it? Those kinds of things.
We have had some questions about that, and the safety for us, has been there. We've not had anything beyond, the typical kinds of things that Dr. Owens just described. And as he has said, you actually want some side effects from the vaccination, because that's your body is responding appropriately at that point in time. The antibodies are kicking in, and that's what you're feeling, that sense of soreness and fatigue and whatnot, and the fever that's can be there. So, we've seen some of that. We're just now getting our second dose, so that may actually be a little bit more noticeable after the second dose than it was after the first dose. I'm getting my second dose today, so I'll be able to give a little bit more of a report.
Get ready for tonight.
Yeah, but you're right. I mean, it is a short run price to pay for something that, frankly, could save my life, could save, the lives of those who take it. Dr. Owens, you might be able to chime in a little bit on this, but I was reading a New York Times article that was indicating how we are underselling the effectiveness of this vaccine. And part of it is that we have a tendency to make sure people know what the risks are, and we have a tendency to make sure, well, there's still a chance that you could get COVID even after we try to cover ourselves with all those caveats. But at the end of the day, even if it's 95% effective, even the 5% that contracted COVID, very, very few, maybe like one death occurred among those 5% in the trials is what I read. I don't know if you have any.
That is exactly right. That's exactly right. And it's very interesting. Let me go on the side effects really quickly first to follow. Curiously, it appears that people older than 60 have fewer side effects from the vaccine than younger people. I found that interesting. Also, people that have already had COVID, since they already have mustered some immunity and survived, they have fewer side effects from the vaccine too. The overwhelming majority, like we discussed, is something benign but uncomfortable, and it's much worse after the second shot. Sorry about that, Ron. but again, and you're exactly right. What happens many times is that we hyperbolize the negatives of about everything. To be fair, um, we have tremendous concerns, for example, about dying on a plane crash, and we don't think much about driving to work, which is 100 times more risky than going on a plane.
Mhm.
But that's just the nature of who we are as people. A vaccine to have more than 90% effectiveness is terrific. 95 is just out of the park. It's extraordinary. And additionally, the fact that it continues to work against some of the mutations that we already have is really impressive. And then about the other ones, we don't know yet. But this vaccine has the potential to be modified yearly, just like we modify the one for influenza or every other year, and get reimmunized and maintain the immunity. Coronavirus is going to remain with us. In fact, our current cold virus is probably started the same way this one did. Now they're tracing back some of the regular cold we get every winter to a epidemic in 1870. We didn't have the technology, but now we do, and would work on cadaveric specimens and that. We're thinking that what was called some kind of flu wasn't the flu, was the common cold virus that we now have when it first attacked us. It was that bad, it killed a ton of people. So likewise here, it's probably going to stay with us. It's going to take a while to become really benign by mutations and remutations. So we're going to be immunizing ourselves for a while and to keeping this in bay. But to have this technology is just such an incredible blessing. Again, I do see the hand of God in that, and putting the wisdom on people to do that and to work so hard to do it. And all of the people that volunteered to do it, including some of our people at Epworth that were volunteering for this study. I mean, that is just extraordinary.
Mhm.
So I'm looking forward to getting more doses and putting in the arms of everyone that is willing to have them.
Yeah, that's great. Seems like that we can't roll those out quickly enough, but it is it is what it is, and many things we just can't control, but we've just got to take it when it comes. So, we've had different phases. I think the state and the national government, federal government has put out different phases, and sometimes that's a little confusing. Can you talk to us about the explain the different phases that what population group should be taking the shot now, what phase we're in Oklahoma, and then is it the same type phase across the state of Oklahoma?
Both are excellent questions. Ms. Settle's still not in, right? So I'm going to have to take that.
That's right. I think he's got technical difficulties and is not going to be able to join us. So
I hear you. The long and the short of it is that the vaccine was first made available to all of the healthcare workers that were in contact with COVID patients. So it was somewhat restricted at first. So, for example, it was available to me because I work in the COVID unit, but not to my nurses at the clinic because they didn't go to the hospital. We're past that phase, and have now immunized about all of the healthcare workers in Oklahoma that are eligible and are willing. So I guess everyone right there at Epworth, of course, everybody in my clinic, everybody that does healthcare and has any possibility of contacting individuals with COVID. The next step is the elderly, and that's already started um, all across the state and is going on really aggressively now. It has been opened then to beyond institutionalized individuals to people older than 65 that are in the community. So that's where we are right now. If you wanted to get immunized, though, the procedure is to log into either the Oklahoma State Health Department or the Oklahoma City County Health Department. They have different sources, so they're different sites. You have to log in on each of them separately and put yourself on the list. And if you click 65 and older, it more expeditiously take you to the page where it asks you how far you're willing to go. And in that case, many times the wait for the local immunization is fairly long, meaning more than a week. But the wait for, say, Pontotoc County is an example I have, or Carter County. I've had patients of mine just go there, and it's usually just a couple of days. But at this point today, if you click younger than 65, it doesn't take you anywhere other than to sort of a backup list somewhere. The supply is not such to open it to the rest of us. Having said that, some health systems have made exceptions to individuals that have significant health situations such as cancer or immunological diseases, and have allowed them to get some of those early shots. The healthcare workers in Oklahoma already are getting their second shot. I got mine on January 6th. I think Mr. Kelly's getting it today. The question that remains at large unanswered is, are we going to continue to give the second shots to everyone, meaning those older than 65 have been immunized, or are we going to try to give the first shot to everybody else? And that is a complex question that deals with epidemiology, immunology, and math. Depending on how quickly you're able to immunize people, you might be better off immunizing all comers than just the people with a higher risk. But if you go at a slow pace that we are going, then you're better off protecting the weaker of us and then expanding to the others. And the reason for that is the bigger transmitters are not the people with the biggest risk. So if you get that transmission blocked in the big picture, you get everyone better faster. But it depends on the speed of the immunization. And right now, we don't really have the supply. Regarding the available in the United States, we have the Pfizer biotech immunization and the Moderna. And they're both mRNA. They're both, like I said, very safe and acceptable ethically and every other way. The Pfizer is harder to keep. They need a lot colder environment before it gets dispensed. So for about a day is the maximum time you can have it out from that deep cold. The Moderna doesn't. We're giving both in our system and in the state. They're both available. Others to come are the AstraZeneca and the Johnson & Johnson, which will be a one shot only, not two.
If this one's not on the pre-sorted questions, but I think it is an important question. If someone got the first shot and needed to take two shots, what happens if they don't take that second shot? And so how important is it to come back and make sure that you get both shots?
That is an excellent question. Let me respond. I had to study that. A lot of patients ask me that question. Once you get the shot, your immunity starts kicking in fairly quickly. And then the question is what percentage, that's the word we use, not exactly what of immunity you get. And you probably get 5% within days, 10, 20. By the time that 2 weeks have gone by, you're probably in the 70% protection level. So if you were never to take the second one, you're just not going to get to the really higher threshold that we use to prevent transmission, but you're still protected. Typically, you move from the 70 to 95 after the second immunization is given fairly rapidly. So that second kicks in even faster. So it's safe to say that you get a little immunity at first, a lot of immunity later, and don't get the perfect immunity or the highest that we can get until a few days after the second shot. As a matter of comparison, I think it's worthwhile. The best influenza immunizations that we get, the years that we get the best, get like 65% protection. The bad years, more like 40% protection.
Yes.
55 is a home run.
Yeah, that's so it really is important to follow up. So Ron, don't let us talk you out of getting your your follow-up shot today.
Doing it.
Now, interestingly, that's the same reaction that you get from the shingles vaccine.
Oh, okay.
It's exactly the same. Like a truck ran you over, but I'd rather get run over by a truck than get shingles. It's pretty bad this season.
Yeah, I had shingles a long time ago, and I don't really want them again. So hopefully I'm over that for good.
God bless you. That's not a fun thing to get.
No, it's not. Ron, let me ask kind of a related somewhat related question. Do you foresee a time at Epworth Villa where people that are living there and coming and going are basically required to have a shot or a proof of shots to be able to be part of the community?
You know, I don't foresee that actually, because the voluntary usage, at least among the older adults, has been virtually everybody. You know, it is the only folks that, to my knowledge, haven't taken the vaccine at that, age group. They've had some reason why they couldn't.
Mhm.
Maybe they had COVID recently, and so needed to wait for a little while, but eventually I think everyone will get it. So, and as long as our residents are protected, I mean, they are certainly the most vulnerable. I don't know that I'll have a significant issue with a visitor coming in who maybe hasn't been vaccinated, especially if as time goes along, we do start to see some form of herd immunity. And but as you know, if the effectiveness of this is what they say it is, I think we'll be in good shape, and our residents should be protected. And so I don't think we'll have to go to that extreme.
Well, thank you for that. One of the things that we have is a little bit off of Epworth Villa, but we've had a question come in around how does the conference guide local churches? And our guidance has basically been that we want to align with the CDC guidelines. Recognize there's some unevenness in some of those. We've not mandated that churches shut down. And for some people, that is an unpopular decision. And for others, just saying to follow the guidelines is an unpopular decision. And so one reason I asked that question of you, Ron, is do we get to the point where we more or less regulate public gatherings from a health standpoint? I've had folks suggest that I'm taking away their right to assemble, or I'm putting people at risk. And so I'd be happy to hear both of y'all give me some good advice around that. And we've got churches all across the board. And frankly, if we mandated that one must close or must stay open, we'd have people that would not comply with the mandate. And so then what do you do with that? Do you take people's credentials away? Do you close their church and sell it or whatever, So it's a complex question. So this sort of it's to the church, but to a little bit broader in society. What are the implications for us both in the church and beyond the church and the community for living with one another, given the context of this COVID virus? I'll let either one of y'all start on that.
I'm glad I'm not the bishop. It's a very difficult position to be in.
It is. Thanks for inviting us into your can of worms.
Yeah, I've got a can opener too. So
I think these are great discussions, and it's helpful to me too to talk about this and to think it through. And because I've thought about what you were asking me, and in terms of how restrictive will we be, and I really believe that if the vaccines, once they become more readily available, and I guess that's probably sometime this summer,
that's correct.
We expect the broad population to have access. At that point in time, I would think that really opens us up to be able to get back to whatever normal is. Because then someone is making a choice to not be vaccinated, and if the effectiveness is what they say it is, I mean, we've basically, correct me if I'm wrong, Dr. Owens, but haven't we pretty much reduced COVID for a vaccinated person less than or equal to what the flu impact would be? Is that fair to say?
That's fair to say. Of course it is. Yeah. It's a much more serious disease, and we have a much better immunization that we do for the flu.
So we've been absorbing that risk, and there has been risk with the flu. I mean, it's a very real thing. We deal with it here, and infection control is nothing new to us. we have always been very cognizant and careful about that. The broader population is learning more about that than they ever have before. But I really do believe that we'll be able to get back to some sense of normal because of that. Now, I'm not really sure what the situation is with folks that are not able to take the vaccination and the risk that they absorb, even though they would rather not absorb that risk. And so there's some sensitivities there. But, perhaps as we watch our positivity rates in the county, and if this really does have an impact, I noticed we went down in Oklahoma County past week. We were at the positivity rate was at 19.9%, and we went down to 16.8. That's still really high. That's still in the red category. But you look around the state, and there are areas that are getting below that 10%, getting below that 5%, and this is still January. We're going to see that continue. I don't know if the vaccinations are having a huge impact yet, but they will fairly soon.
They will.
I think.
Very true. Well,
So,
with vaccination rates up,
right.
With vaccination rates about 95% or higher, then the remaining people are much safer. So that's a threshold that's worth getting to, because people that can't take it for one reason or another. So we're protecting them by virtue of protecting ourselves first with the immunization. Interestingly, the measures that we've used have been more effective than anybody imagined. And we have that by the proxy numbers of influenza. Our influenza rates for this season are 74% lower than usual. 74. So the silly mask protects us against COVID and also against influenza. The rates of colds are down too by a significant amount. I'm not suggesting that we wear a mask for the rest of our days so we'll never get anything, but I think what this could lead us to, if we're blessed and lucky, is continued efforts on expansion of vaccination technology to the point that we have a really effective influenza vaccine, not the one we now have. And then we can reach the status we have on certain other diseases. We don't wear a mask to protect ourselves from measles.
Right.
We're protected because more than 90% of the population is immunized. And the same applies to polio. So if we can put a lot of research and finance into developing a stronger, more robust immunization interest, this will be a fantastic outcome of this tragedy.
Let me ask, this is a little bit different, and it also wasn't in the preset questions, but I haven't done a real good job following those to the letter anyway.
No, you're doing great.
If I get the vaccine, or any person gets the vaccine, can we still be a carrier and infect other people?
Gosh, that's the toughest question you asked today. And the answer is, we do know that the vaccine prevents you from getting sick. We know
Yes.
that. It's not clear whether it'll prevent you from transmitting the virus to another person. The belief right now is that you might still be able to transmit it, but at a much lower transmissibility rate than the natural one would be. And there's a chance that you'll also be unable to transmit the disease. But yes, it's essentially manufactured and produced in the effort to decrease the ability of your body of getting sick, not necessarily of transmitting the disease. So that's always an unknown at this point, and always a risk that you may still transmit the disease. But this particular virus, one of the reasons it's been so effective in transmission is that you have several days before you get sick that you're transmitting it fairly actively. And then you can also transmit it if you never get sick. Those two are very rare in influenza. You transmit influenza maybe for the day before you get sick. We don't know that people transmit influenza when they're asymptomatic for long periods or when they don't have symptoms. So it's a different animal. But yes, you're right. We're not 100% sure that this is going to prevent you from transmitting it. But we do know that prevent you from getting sick. And we know that getting sick makes you a better transmitter of the disease anyway.
Yeah, one of the implications for that in my work is that a lot of times I go to places and there are large crowds of people, which I could be a super spreader. Even if I didn't talk to all those people, we would gather people and there'd be sub spreaders. And so, one of the questions we're wrestling with is, do we have our annual conference in person? Do we do that online? And I'm inclined to not meet in person just because we value human lives and we value our people. But we get a whole bunch of people together. We know some will be vaccinated, some will not. And then if those of us who are vaccinated can actually still spread the disease, we could start a mini pandemic just out of annual conference. So those are also considerations around, our local churches and then our conference gathering, which would be statewide. So we could very easily spread something statewide in a weekend. So
This
that's
is Mr.
certainly a
Kelly's area of
consideration.
expertise.
Yeah,
He has to deal with this big time. And
yeah,
he did, and I'm going to let him say it for himself, but he used the retrospectoscope. It's this special instrument when you look back and you feel
yeah,
like that. And essentially you think to yourself, well, if we didn't have these gatherings, they're going to say I'm a jerk.
yeah.
If we did have them and 100 people died, then
Oh,
I'd be a little worse shape with the Almighty. So let's just go for being called a jerk and let it.
all right.
Your thoughts, Ron?
I agree. It's all in the timing too. And as I said, until those vaccinations are readily available, and if somebody wants it, they can get it.
Mm-hmm.
You've got to, you got to have sensitivity to that. Maybe if the positivity rates are really low, that's something to watch. And how long in advance of that, that you wait to make that call. I don't know, but yeah, those are the kind of things we've had to deal with around here, is watching, determining, when's it safe to do this, when's it safe to do that. And so I understand.
Yeah,
We
that's a
have a
tough one.
model for a good vaccine already with polio.
Oh, yes.
Polio, everybody was wearing their mask. We were doing crazy stuff. We were fumigating homes with hoses, with trap hoses back in the 50s. We didn't know how the virus was transmitted.
Mm-hmm.
And as the virus immunization kicked in force, within a year or two, it was obvious we got this taken care of. It's going to be rare cases anymore. You don't have to wear the mask. You don't have to put insecticide on your home. This is going to be all right. And that thing's going to happen here too. We would, Kelly, it's not going to be next week, but it's going to be soon.
Well, and you did allude to that earlier, just the polio, measles. I guess you could add mumps to that, even though it's not as deadly. But even chicken pox and shingles, and there are all kinds of vaccines now that have basically let us, quote, normalize our life again. And we've just not had this kind of disruption that I remember. And I wasn't around when polio was at its height. So I may look old, but I'm not that old. So,
it's interesting, the generational differences. I mean, our residents remember that. And so
yes, they do.
They were, it's almost like, what? I not take the vaccination. Why on earth would I not take this vaccination? But the younger generation is different. I don't know what age it starts, but somewhere younger than me. And so some of our staff, have really struggled with that. And so we've done a lot of education and in fact, I think we're seeing a pretty big increase because of the education that we've done. And Dr. Owens is one of the primary reasons for that. And actually, we're much better off than most when it comes to our staff accepting the vaccination. We're probably, after this second round, and there's going to be some people that waited for the second round to get their first dose because it was new. They were uncertain about it. But we're probably going to be, maybe twice as high of a percentage than what most people are, and that do what we do have gotten. So we feel very blessed by that.
Positively. Success breeds complacency, but also we're victims of our own success in the way that, like you're saying, a lot of our members at Epworth, they have seen a brother or a sister or a cousin die of polio,
Yes.
die dead, or suffer the miserable existence of the iron lung. They seen people die of measles. We haven't done either of those two things. None of us three are in this group.
Yeah.
We're not Miss Hasty. So you have to read about it and hear about it. So it's harder to get that impact, but it's so extremely important that we keep reminding ourselves not to make mistakes about it now and to emphasize immunization.
Mm-hmm. Mm-hmm. Yeah. I've heard, of course, and the cost really shouldn't be a big consideration here when we're looking at saving not only our own life, but other lives. But this vaccination is free, is it not?
It is.
Okay.
Well,
So,
it's not free. It's paid by a governmental institution.
Yes, yes. Yeah.
Not by the individual.
Mm-hmm.
We pay for it through our taxes.
But for an individual that says, I can't afford it, that's not an issue. That all they'd have to do would be to go to go online and receive vaccination through the health department. Or are pharmacies coming on board yet, or is the vaccination not widely enough distributed? I've heard CVS pharmacies were going to be points of delivery,
Ron?
and I haven't seen that yet.
Yeah, I don't think that they are broadly. They are going into the long-term care communities, though. Walgreens is actually
Okay. Well, yeah,
organization, and CVS is are the two. So that's who's here today. We've got Walgreens representatives in our health services area.
Oh, okay.
And they'll also do our assisted living. Now the county is actually the responsible for providing the vaccines for our independent living group, and they're on a different schedule. Walgreens does the Pfizer, the county does Moderna, so it's a little disjointed, but we're getting everybody covered.
We're going to get to that 95%.
So far to get the same shot every time, yeah.
So, right.
Oh yeah. Oh, thank you for that. That hadn't even come across my mind. I think I assumed it was once you start with one brand of shot, you would be better off just to stay with that same brand.
Having said that, this disease has been so overwhelming that the science is moving at a rapid pace. They're already considering the possibility, not recommended, of if you had Pfizer, get the Moderna next, but it's not happening. It's just the situation is so dire that they realize we got to do what we have to do to get our economy back on our feet, to get our lives back together. There's other areas that, Mr. Kelly and I have been discussing privately. Mental health. This is really putting a tremendous.
Oh, yeah.
I mean, to go days, weeks, months, a year without having the human contact, without giving a hug to somebody. There's people dying from that too. So we need to be, aware. Like Mr. Kelly was saying, we need to open up again. Just not do it in a hurry, but we have to.
Mm-hmm. How do we address those mental health issues, Ron? Would you elaborate a little on that? We face them in the church. We face them among clergy. We face them in every corner of society, essentially.
Well, I mean, I think the virtual means is at least an attempt, and it does help some. But so we've really done a lot more of that kind of communication, and assisted residents too that may not be familiar with technology. We'll have our iPads and we'll go around and do that for them and with them. So lots of staff effort has been put into that. But there is something about human touch that you can't discount. I mean, it is a very real issue, and so there is some harm that is done. There's no doubt about it, and so we just try our best to overcome that by doing other things. And we've done outside visits and things of that nature, but still not the same as that one-on-one contact. But hopefully very soon, if we can get these vaccinations, wait a week or two after that second dose, we'll see what the federal government has to say about the regulatory side of this from our health services and assisted living side. We really rely on them to tell us what to do in that arena because we are regulated. But we'll see. Hopefully they'll take into consideration that these vaccines are effective and they'll loosen some of the restrictions that we currently have.
That would be fantastic. Now, it was bound to happen about 3 days ago. I'm sure you saw in the paper. Finally, they figure who gets things to you quickly. So they're starting to negotiate with Amazon about distributing the vaccine. So that may accelerate things quite intently. Of course, the manufacturer is the biggest step now. It's just to get it made. But we're living in interesting times, unquestionably. The one thing that I regret is the politicization of all this. And, I'm a somewhat conservative person, but I don't think politics should be involved in medicine. I never envisioned in a million years that we'll be having political discussions about getting an immunization or wearing a mask. But hopefully everything will settle with cooler heads prevailing and realize that politics can stay in politics and medicine is a different thing.
One thing that did change early on, we had very little opportunity for visitors to come in to our health services and assisted living. It was really just end of life situation. So someone was very imminent death, and then they would allow visitors to come in. Somewhere around September, October, I think it was, CMS made a change so that if the psychosocial well-being of a resident was at risk, then we could orchestrate some compassionate care type visits. And I'm really thankful that they did that because, that was after several months for many folks. And so there has been, some ability that we've had that has really helped, but it's still not the same as to what it was.
Yeah. And a lot of that went hand in hand with the developments too. Remember when we started this, you couldn't get a mask anywhere.
That's true.
Dramatic shortage of that. So contrary to what we now hear, the health authorities were telling us not to get masks. Why? Because they need to save them for the doctors and the nurses. That developed quite rapidly after that. So the masking was available. The other PPE became available. And we learned more about how the thing is transmitted. So that led to more open doors and more ability to get visitation and in dire moments. So things just evolved as the science and the availability of items came. Testing was essentially nil. Marge, well, I don't know if you recall that it was a quasi scandal that the NBA player was able to be tested so quickly. And now anyone can get tested fairly quickly. And that, of course, changes the whole perspective. You have a person that has the full PPE, has been recently tested, or even had a shot. Sure, you can make accommodations to have them be with their dying mom. We have a lot to be thankful for the great efforts of our public health officials.
Someone's asked in the chat a couple of questions. I'll catch them before we end. We're getting really close to the end of time. After the second shot, about how many days or weeks or whatever should one wait until feeling that they've achieved 95% immunity and can basically move around in society?
We don't know for sure, but as I alluded to earlier, it's after the first shot, it starts ramping up every day. And after the second shot, you should be within a week or two of getting the full coverage.
Okay. So if somebody had a concern, then we could say as a rule of thumb that they might wait 2 weeks after the second shot and then feel pretty assured that they could get out.
That is probably accurate, but nobody knows for exactly sure.
Mm-hmm. I do want to, we had another question that came in around church meetings, and I do want to just make this statement that every pastor that feels that it's in the best interest of their congregation or themselves, if they're at risk, to not meet has my full support to not meet as a church. And so, that's just, you've got my support, you've got the superintendent's support. it should not be that we put ourselves at risk because there are people in every congregation, some saying we got to meet, some saying we shouldn't meet. But every person certainly has they've got support there. I'm inclined to say as well that we won't have annual conference in person in May. So that was another thing. We haven't made that final decision, but that's another. Since we had some church folk on the webinar, I thought I would just pitch that in right quick. But I appreciate y'all being here so very much. I notice it is 1 o'clock, and I just want to see give you each a chance for a parting word. Dr. Owens, would you like to make a parting word for us?
Thank you for having me. This is rough times, but with the help of God, He works in mysterious ways. We're going to get this.
Amen. Mr. Kelly.
I would just add an appreciation and thanks for all of our United Methodist friends that have prayed for us and supported us in your encouragement. And, we look forward to being able to have you folks come and visit more regularly and reunite. But until then, thank you.
Well, thanks to both of you, and I greatly appreciate your presence here today. And I think we are at the 1 o'clock time, and we promised we'd hold this to an hour. And so just God bless you all and the work you're doing. It's serving our society so well and serving the population there at Epworth Villa. We really do appreciate your dedication, your service, and all that you do. So with that, blessings to you. And God bless each of you who have joined us today, either live or seeing the recording. May the Lord bless you and keep you, and may the Lord smile upon you and your family. Amen.